Okay, so what did you come up with? So what of them is the most obvious? I'd say there's two obvious ones.
Fourth one has to be, well, the last one you said was like the next one.
So these are actually matched up already.
I didn't know.
So when you look at type 1 versus type 2 versus normal, so of these two, if we compare type 2 and normal, what's in type 2?
Just TC and LDL. Are you talking about like lipids?
Like the LDL, yeah,
Oh,
LDL,
okay,
like what lipid components are in there? So there's LDL in type 2, type 2A. So LDL, the size, the diameter for that LDL, and HDL for that matter, is really small. So it's not really going to scatter the light very much when you just look at it visually. So LDL, this sample that has LDL and HDL in it is going to look pretty normal until you do the subsequent tests, typically enzyme tests, and then two will come back. It'll look normal, but this one will come back with high levels of LDL in it. So, and then the next one is this one. So if this is type 1, what is that? This is chylomicrons, and a classic chylomicron sitting at the surface of this sample. And chylomicrons, we know that this is the solubilized version of dietary fat. So this looks just like fat. So it doesn't have that yellowy tinge that some of the other ones do. It is really white. It's really hydrophobic. Well, not really hydrophobic. It's very less dense, so it's going to sit and come to the surface. But in 24 hours, it'll create a nice layering of the chylomicrons on top of the rest of the plasma.
Is that one harder to like move through than the other ones?
Oh, definitely. Yes, definitely. Because those chylomicrons are maybe 500 times bigger in diameter than the little LDLs and HDLs. Okay, so these are two pretty obvious ones. And so now, do chylomicrons appear in any of the other types?
They're at the top of the last one.
Right, there should be at the top of the type 5. So they're definitely here. Maybe not quite. Maybe you can just kind of see it a little bit like that. So they're sitting at the top of the type 5. And so do the type 5 have high cholesterol, have high chylomicrons? Mm-hmm. Yes, they do. So here's the chylomicrons in that one. So now we're left with 2B, 3, and 4. So how should we distinguish between those?
4 only has VLDL.
Right, so 4 only has VLDLs. So what characteristic should we be able to look at for this one and then comparing it to the 2B and the 3? It would be better if we had it in real life, that you could look at it.
Well, you can like kind of see through the 2B and 1.
Exactly. So the turbidity on this VLDL is way high. And the 2 and the 2B, or 2B and 3, have much, much less turbidity. So why would that be? So VLDLs, where are VLDLs relative to chylomicrons and LDLs in that scale of decreasing diameters?
Closer to,
Right, so they're closer to the chylomicrons. So in size, the chylomicrons come first, then the VLDLs, and then the IDLs, and then the LDLs, then the HDLs as we go down in diameter. So these bigger diameter ones, you would imagine, is good to see that these are going to scatter the light much more, and they have much more of a chylomicron look to them. So type 4 will have lots of VLDLs. Okay, so how should we distinguish the 2B and the 3 then?
2B has LDLs.
Okay, so 2B has LDL, and it has VLDLs. And what does 3 have?
IDLs.
And 3 has IDLs.
So, for the 2B, is it less turbid because it has high LDLs as well?
Exactly. So the LDLs are basically diluting this one. So if you had the type 4, but you took that sample and diluted it with type 2A, you would get type 2B. So this sample is, this one doesn't really show. Or I should say has little turbidity. So you can still see through that, some of that, only because that VLDL is being diluted by the basically transparent LDL component. And then IDL kind of looks like like another shade lighter of the VLDL. So this one looks a lot like this one, but not as pale as this one, but not as dark as the VLDL. So it's the guess, the intermediate one. Cool. So now you have a good visual when you tell somebody, okay, you have, let's take a blood sample, and then when it's being taken out of their arm, and you can look at it and you go, oh. Back in the day.
That well, like that it's.
Oh yes. Back in the day, we used to be able to do, when I was at UVA, the undergrads used to do a blood test where they would go get samples from the hospital. And we'd walk down the street with our little rack of blood. I can't do that. I don't do that anymore. But this is exactly what would happen. Stick them in the refrigerator and they come out. Usually some of them will come out looking like this, but after they're in the refrigerator, they do this. And so you're just like trying to take that and now shove it through your arteries and then expect you to not have high blood pressure and, just.
When did they come up with like this current testing?
So I can look up this test. This one was, Fredericks did his method is accepted by the World Health Organization. So it's probably been around since the 60s, but I can look and see if it's even earlier than that. So they knew stuff, but as like diseases and communicable diseases started to come up, they started to do more wet chemistry tests for stuff, and then realized that blood samples were not just to be kind of casually, thrown in the refrigerator, and then they started, doing tests like this and saying, hey, let's do a quick test on it and let's just do a visual and see what happens. And as the risk of heart disease goes up, and since then, these become more and more important. Okay, so what I want you guys to do for Tuesday is this one, the first, there's two cases, case 1 and case 2, good names. And I want you to see if you can answer the 2 questions that are on the bottom of each of these slides. So what kind of abnormality would you expect, and what kind of diet would be helpful in treating that patient? So unfortunately, case 2, I don't have a blood sample for case 2, so you'll just have to kind of pick apart the criteria and some details inside that case to see if you can figure out what's going on. And so for Tuesday, we'll do these 2 cases. We'll do our our dyslipidemia. Maybe we should do our quiz on Thursday. Want to do Thursday instead? It doesn't matter. Let's do Thursday so that we can finish up this last little bit. And then, so we'll do our quiz on Thursday. And then, and so Tuesday we'll do the 2 cases. We'll do the dyslipidemia puzzle, and then keep working on 8, packet 8.